Sandy Wiley. Welcome to my mental health channel, where I wipe away the stigma of mental illness by talking about my own personal struggles, having borderline personality disorder, complex post-traumatic stress disorder, anxiety and depression. I talk about narcissism and schizophrenia, and I wrote a memoir, Life with My Schizophrenic Father, here about my childhood. I talk about my unethical psychologists who I've had unethical and sexual relationships with, and I've written many books about them. The links to all my books are down below in the description. They're all available to be purchased on Amazon. You can also support my channel by buying me a cup of coffee, and I want to thank the people that have done that already and the people who have purchased my books. There's only one caveat here. I am not a licensed therapist. I do not hold a degree in psychology, so I cannot diagnose you or give you a professional opinion. All I ask in turn of you is your kindness and respect in the comments. Now, if you are new to my channel, welcome, welcome. Please hit that subscribe button in the lower right-hand corner. That way you will be notified every time a new video of mine comes out. It's 100% free, so stick around, take a chance. Please share my videos on your social media platforms with your friends and your family. Your opinions, your thoughts, your struggles matter to me, so please, I want to hear from you in the comments, and I will always respond to everyone's comment. Today is a very important video that I am doing. It's how therapists misuse transference in therapy. Now, what is transference, first of all? Transference is unresolved relationship patterns that a person has in their head. It's unconscious. They're not aware that they're doing this. And this comes up in every relationship that the person has, especially with their therapist, because a therapy relationship is very intimate. Now, what this means is all the patterns, the abuse, the trauma that the patient has had with their parents, their mothers, their fathers, or important people in their lives, is all going to play out into the therapy relationship. The patient is going to project and displace all of those feelings that they had on a historical figure. Most likely, like probably 90% of the time, the parents are going to be those people that they are going to displace, project all those feelings they had in the past on people who have hurt them, who have traumatized them, their parents, on to the therapist. And the therapist has to know how to allow the space and be able to contain all those feelings, because those feelings will be rage, sexual feelings. There'll be like a ton of hurt. All of those feelings that you've had in the past from your parents you will be projecting onto your therapist, and you won't even be aware that you're doing it. And if the therapist cannot hold and contain those feelings, if they react to those feelings, that's where the danger lies, okay? This is what happened to me with Dr. 𝗵𝗂𝗶𝗶𝗲𝗲, okay? He could not contain my feelings. Neither could Dr. Richard Geist. The therapist is not supposed to react to the patient's feelings. They're supposed to contain them. Now remember that the therapist is a patient himself. Even the therapist has a past, right? The therapist might have been abused and traumatized in their past, so they could be projecting their own shit onto the patient, which they're not supposed to be doing because they're professional people. Or if they are, they're supposed to be in their own analysis and be able to be aware of those feelings and not react to those feelings. And that's called countertransference. When the therapist who's trained like 10 years, who has a doctorate degree on the wall, who's gone through internship and extensive training, they're supposed to know when these feelings are coming up for them, the countertransference, when they are projecting their own shit onto the patient. And they're not supposed to react to that. And Dr. 𝗵𝗵𝗶𝗶𝗲𝗲, Jim, he put his own shit from his own past, his own traumas and abuse from his childhood onto me. And then we reacted out, and this is when it becomes extremely dangerous. All right? Very, very, very dangerous for both the patient and the therapist. Because when you react on on the transference, what you're doing is you're like setting fire. You're just in an inferno. Everything will blow up in your face. The patient will regress. They could harm themselves or harm someone else. The therapist could act out sexual fantasies like he did and harm the patient, abuse the patient, and lose their license, and the patient could, it's just a mess, okay? They're trained not to do this. They're trained many, many years. It takes a long training. They have to get a doctorate degree. It takes years and years of training to be able to do this. Most therapists are incapable of handling the transference. That's why I no longer go to therapy, because every single therapist I had failed at containing the transference. And that's the good feelings as well as the negative feelings. If a patient has sexual feelings towards you, you shouldn't be flattered. You shouldn't be acting on them, because looking back and analyzing my own shit, and this took me many, many years away from the therapy, away from these inadequate psychologists, all right? This has been going on for 3.5 years where I've been analyzing my own shit on my own with the help of nobody but myself. Not even from reading books. I've just been doing this totally on myself. What was going on with me in that therapy, why I was, sexually abused, is because of the Oedipus complex. The Oedipus complex, in case you don't know, is when a child is between the ages of 3 and 6, that they form sexual feelings for the parent of the opposite sex, and they hate the parent of the same sex. So, if you listen to The Doors, I love it, Jim Morrison. In one of his songs, he says, Father, I hate you. Mother, I want to you. I can't say it on YouTube. So what he was talking about was the Oedipus complex. I hate my father, the person of the same sex. I compare myself against him because my father is taken away. I'm jealous. He's taken away all my mother's attention, who I want to have sexual relationships with. This is in an unconscious level. This is a normal part of growing up, okay? It's not supposed to be acted upon, okay? I'm not talking about acting upon those feelings. I'm talking about what a child normally has that they're not even aware of. It's normal part of development. What happened in my therapy is this Oedipus complex was played out with my therapist because they could not contain the transference. They were getting flattered and thought I was, they couldn't handle my attraction to them. They couldn't handle my sexuality. They couldn't handle any of these normal feelings that come up in therapy. That's all a part of the transference. all of my feelings from the past are projected onto the therapist. And the therapist is supposed to have a safe container. That's what boundaries are. Boundaries are a safe container. So the therapist is supposed to, none of them have. That's why I've quit therapy and I never will go back to therapy, because none of them can handle the transference. The container is the boundaries. They're supposed to hold your feelings safe and not supposed to act on it. Whether you're enraged with me, I'm not supposed to take it personally. I know you're projecting all your hurt feelings from your past with your mother or your father. If you become sexually attracted to me, I'm not supposed to be flattered and say, oh, wow, that guy really wants me. If I'm a therapist, I'm not supposed to feel that or if I do feel that, I'm supposed to analyze it myself, because it has something to do with my own shit, okay? I'm supposed to say this is a safe place to feel whatever you want to feel. And I will contain it and not act on your rage. I will not act on your sexual feelings toward me and take advantage of you. And this is why I never got better. In fact, I got more sick going to therapy. I got very sick. I turned into an alcoholic because these therapists misused the transference. They did not contain my feelings. They did not contain my sexual feelings. They did not contain my feelings of rage. They didn't contain any of my feelings. They did not know how to handle the transference. They did not give me a safe place for me to be able to work through those childhood patterns, those unresolved relational patterns in my past. And that's what successful therapy would look like, except I've never had successful therapy. I only was re-traumatized in my therapy because of the therapist, because it was very, very dangerous. They were playing with fire. And when you play with fire, you get burned, okay? We all know that, right? They did not know how to handle the transference. So I want to just, let people be very aware of what's going on, what happened to me. And this is like my mission. This is my whole reason for the YouTube channel, really. My whole reason for writing all these books. I stated in the book, what happened. I show people what happened. I show people how these therapists could not contain any of my feelings. My father abandoned me when I was a little girl in that Oedipus complex stage, which is very, 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 very crucial, which is between the ages of 3 and 6. He left. He had a mental breakdown. He was committed because he had paranoid schizophrenia. He had a mental breakdown. He had more than one breakdown. He left me with a narcissistic mother who brutally beat me, taunted horrifically. I've said all the things she did in other videos. And I felt extremely abandoned. So subconsciously, I was picking older men, especially after my dad and mother died when I was 38 years old. I was 38 and they died within a couple of months back to back from each other. And I was an only child. I lost my father. I was only 38. I never really had my father completely anyway as a child because he had a horrific mental illness that prevented that. And subconsciously, what I was doing, I was picking older male psychologists old enough to be my father. Dr. 𝗵𝗗 𝗵𝗃 was in his 60s. And I was 40. He was old enough to be my father. I was subconsciously doing this, picking these older men because I was looking for a daddy figure. And these older men, Dr. 𝗵𝗗 𝗵𝗃, what he does is, he takes his patient's idolization of him and uses that, all right, to keep those patients always coming to him, always paying him the $300 fine, never wanting to leave therapy, because they idolize him. See, the transference is holding the patient's feelings, both the negative and the positive feelings. It's very, how can I put it? When someone is idolizing you, you can be swept away in that. If someone is, putting you on a pedestal, having sexual fantasies of you, you can think, like, you can take that personally and think that, oh, wow, look at this very attractive younger woman, she has a hots for me, like, it can put like a feather in your cap. But if you're a really good therapist, you won't be affected by that, because you'll know that that's transference, that I'm transferring all the feelings I had as a little girl during the Oedipus complex phase, when the child is attracted to the parent of the opposite sex and hates the parent of the same sex. And what happened during that Oedipus phase is my father abandoned me. So that's like the worst time a father could ever abandon their child, is during that time, during that Oedipus complex phase in the child's life. And so it gets reenacted by these older therapists who do the exact same thing. They can't handle it, they can't contain it, and they abandon me in the same exact way that my father did. And by the way, you will, excuse me, I've had a terrible cold. I still have a frog in my throat, but you will act these out in your personal relationships later on, because you've never resolved it. If you didn't have a good therapist and go through this and resolve it in the therapy, you will act it out you will pick partners in your personal life that will play this out, will reenact your childhood, basically, and re-traumatize you over again. So now that I'm aware of this, that I stay away completely from therapists, because therapists can't handle it. They can't handle the transference. They don't have a container for it. They react to it, and they take it personally, and they misuse it. If a patient is sexually attracted to you, you don't go out and have sex with them. That's misusing the transference. If a patient is, angry at you or enraged, usually they're projecting something they see in you of their past, with their past parent. To get angry and upset with them is not to be able to contain their feelings, to work through those feelings with the patient. Instead of, I had other therapists too who couldn't handle the anger, who couldn't, who, not just the sexual feelings, but the angry feelings. They would take it personally. They wouldn't be able to contain my anger. And this really needs to be addressed, because you should not be taking anything personally that the patient is saying to you, all right, or feeling. You should try to be getting at the source. Where did that come from? And work that out with the patient in the safe containment of the therapy office. And the therapy office has never been a safe containment for me. It's always been these therapists can't handle their own shit. And here I am, 60 years old, an alcoholic. I have severe anxiety. I don't trust anyone, because I never worked out all this in the therapy office, because no one could contain my feelings. My parents couldn't contain my feelings. My therapist couldn't contain my feelings. So I never had a safe space for anyone to be able to contain my feelings. So I hope this gave you a little insight into about therapy and what the role of the therapist, and especially about transference and how dangerous it is when the therapist misuses the transference, and just make you more aware of that, both professional people and everyday people. All right, until next time, take care. Bye-bye.